Good morning. It is Tuesday, August 3rd. I'm Jessica Lovell. Welcome to the Morning Medical Update. Today we are talking all about breakthrough infections. A lot of you have been asking about this each week. This happens when a fully vaccinated person still tests positive for COVID-19. We're going to hear from Micholee Polsak on her breakthrough infection and how it could have been much worse had she not have been vaccinated. Of course, Dr. Stites sitting right here next to us with lots of good stuff
Always
for us today. Good to see you. Good to see you both. All right, but first, let's get to Dr. Dana Hawkinson joining us with our COVID count. Good morning to you.
Hi.
Hi. Any changes in the numbers?
You know, not really. Our numbers have been staying really in that mid-30s range for active infections. We have 37 active infections today, with 12 in the ICU, but unfortunately 10 are on the ventilator. And of those total 37 patients with active infections, 7 have been vaccinated. At Hayes, they have 8 total patients with 7 active patients and 1 in that recovery period. And I was corrected by some of the Hayes people yesterday. They did get up to a total of 40 at one point. So they are still far from that, which is a good thing. But, you know, their numbers are pretty high.
Yeah. All right. Thank you for that update. Are we going to hear from any reporters today? Anybody on the line? No reporters. All right. All right. So get your community questions going. We're going to get to those here in just a few moments. And before we dive into Dr. Polsak's personal stories, Dr. Stites, do you remember this video?
Am I back in the freezer?
I vaccinate for all the patients that we've lost here and throughout the country who never had the chance.
I vaccinate to protect the community that I serve.
I vaccinate because I want to protect myself, family, co-workers, and my community.
So I can see family and friends and travel again.
I vaccinate because I want to help save the world.
Because I have a 4-month-old baby to protect at home.
To protect my immunocompromised son and my entire family.
So I can protect my children, the rest of my family, my friends, and patients.
I vaccinate for my immunocompromised husband, my newborn baby, and so I can smile at my patients again.
I vaccinate because I've had COVID and I don't want anyone else to have to deal with it.
I vaccinate because I'm a single mom and my daughter needs me.
Because I've seen the data, it's been made public, and I trust the science.
Because I want to hug people again, and I think it's one of the most altruistic things you can do.
Because getting the COVID-19 vaccine is one of the most fulfilling public health acts I have participated in my 43 years in healthcare.
Because this is the power that I have to help end this deadly pandemic.
That's good.
I love that video.
Those
are some folks here at the health system just reiterating the message that we share here every single day.
And it is so important, right? Because we know that vaccination is really the way out of the crisis. We want to share some information with you. Yesterday we referenced one of our concerns about the transmissibility of this, and yet one more reason you need to be vaccinated. And one of the concerns is this concept of R0. How many people does one person infect, and how fast can that occur? So with the original strain, it's guesstimated that it was around 1 to 2 people, and it would take 10 to 12 minutes. With the Delta variant, there's some data from the CDC that was leaked last week. Now, it's leaked. I'm not a big leaky reporter here, but it is also information that other folks in other aspects of this pandemic have quoted and referenced and talked about, which is an R0 of 6 to 10. That means one person could be infecting 6 to 10 other people. That's a really high number, much higher than the original strain. And the concern is that it makes a lot of people much more vulnerable. And part of the reason that can happen is it takes less time to infect them. Is this graph? This comes out of the New York Times from about 2 days ago, I think, and it was based upon leaked data from the CDC, in which the head of the CDC was quoted as saying that the Delta variant is as transmissible as chickenpox. That's not good, right? That's like really bad, because chickenpox and measles are incredibly transmissible. If you think about how when one child gets the measles or chickenpox in a classroom, how that can spread to a whole bunch of kids really rapidly because they're in close contact, and it doesn't take very long. And that's what this graphic does. You can see where the original strain was, you can see where SARS was, where MERS was, where you can see where other diseases have been historically, and where chickenpox and measles and now the Delta variant are all in the same range. That makes this variant, this type of COVID, or this type of SARS-CoV-2, much, much, much more dangerous to all of us. So then we have to ask, how do we protect ourselves from something so dangerous? And the answer is that the rules of infection prevention and control continue to travel with you. They continue to keep you safe wherever you go. And they are complemented by the science around vaccination. And just like those folks who were so inspirational a moment ago in talking about it, that's the answer we all need to hear. If we're going to keep each other safe and we're going to stem this tide here in our community, we're going to have to put our masks back on and we're going to have to get vaccinated. And we'll show some more data about the impact of what's going on in our community in the next couple of days. We've got some information about how rapidly it's grown, how full hospitals are, and how this Delta variant is perhaps the greatest challenge to us of the entire pandemic.
Dr. Seitz, we get a lot of questions about breakthrough infections.
We do.
So we want to talk with Dr. Polsak and just give a little bit of background here. So you were fully vaccinated,
Yes.
Almost as soon as you possibly could be vaccinated. You started to feel sick, thought you might have bronchitis, but turns out you tested positive for COVID-19. Talk to me a little bit about that, the concern, the surprise that you had. Tell us the timeline a little bit.
Yeah, so I was fully vaccinated by mid-January, as early as we were offered, and tested positive near the end of June. I was feeling fine until one day I was not. And at first I was just a little fatigued, didn't think much of it, but I knew that that wasn't my norm. And so I honestly got tested right away, not because I thought I had COVID, but because I wanted to be safe for my patients and I wanted to protect them. I wanted to know that I could continue seeing patients even if I had a little something. At the time, it was just a very deep cough down in my chest. And like you said, I thought maybe bronchitis, even pneumonia. Didn't dream it was COVID. So I was tested within the first 24 hours of being symptomatic. And then 24 hours later, found out that I was positive, and I was shocked.
And you didn't think it was COVID, was it? I mean, we know you got tested because you see patients, but you didn't think it was COVID because you got vaccinated?
I was vaccinated, and I hadn't been around anyone that I'd known had COVID. I hadn't had any patient exposures that I was aware of. I didn't know any personal friends, family contacts that I'd been around, so I was shocked.
Quite shocked.
Okay. Because I'd made it a year and a half without getting COVID, despite being in instances where patients later told me after our 40-minute long visit that they actually were positive.
And you're here every day, so you're staying very safe.
Correct.
So you have a young family. How did you take those precautions to keep them safe?
I immediately quarantined as soon as I knew. I saw my positive on my chart and put a mask on. Kids put a mask on. My husband Lysol'd as I was walking up to the third floor to go into isolation for 10 days. So I stayed away from them for that entire time. Occasionally I would, with my mask, with their masks, with no one around, walk down, grab something if I needed to. But pretty much I was on the third floor for 10 days in jail.
In jail. And you had
COVID jail.
Yeah, right.
Yeah.
COVID jail.
COVID
So
jail.
you were recently diagnosed with an autoimmune disorder. Tell us a little bit about that. And how do you think that impacted how you were feeling?
Yes. So in mid-May, I came down with Graves' disease, and that's an autoimmune thyroid condition in which my thyroid gland is overproducing thyroid hormone. Impacts everything. Your thyroid impacts your metabolism and how you feel. For me, it was shortness of breath and fast heart rate. So two things. I think that's probably what made me a little bit more susceptible to getting COVID because my immune system wasn't quite on par yet. And the other thing that was frightening is that those symptoms I was experiencing from Graves, the shortness of breath and tachycardia, very similar to what you would get with COVID. So it was going to be very difficult for me to know, am I having a complication of COVID such as a blood clot in my lungs, or is this just my Graves on top of that? So I was worried. I knew as a vaccinated individual that I should not get as ill. So that was comforting. However, I think as physicians, we know too much and we know what can actually happen, all the bad things. And so, of course, my mind went to the worst possible case. But fortunately, I was okay. I did have a deep cough, exertional intolerance, very fatigued, only had fever for a day, but probably 7 days or so of symptoms, respiratory symptoms.
Dr. Seitz, I want to ask you about something, and maybe Dr. Hawkinson can add in too, but we get this a lot. Is it true that fully vaccinated people with COVID might be less likely to spread the disease?
Well, we think less likely. I think, Hawk, don't you? That maybe I've seen it by a factor of half, but it's not like where it was with the original virus where people just didn't spread it once vaccinated. Now, you may still spread it, and that, I think, Hawkeye, that's one of our big concerns.
Yeah, I think we still do need more of the basic science. We do have a pretty good smaller study from some Chinese and English researchers looking at viral loads, which showed based on PCR and RNA that you could potentially have 1,000 times more viral load compared to for the Delta variant compared to the original Wuhan strain. So we have that, and then of course we have that CDC MMWR that was published about that outbreak, that retrospective or observational study looking at Provincetown, Massachusetts, where they then use that to help guide the new masks. So I think, originally we thought, yeah, you probably significantly had a lower amount of being able to transmit the disease, but now it looks like it's about the same if you are vaccinated or unvaccinated. So, but I think we still need to kind of explore that question and really get some firm data on that.
It is a concern, though, and so I think you absolutely did the right thing about it. But also that you can get sick even if you've been vaccinated, and I think that's another point to highlight. The vaccine was never, remember, it never said you won't get COVID. It said you won't get hospitalized or die. Now, what we're seeing with the Delta variant is that you may even still get hospitalized. So that's a little scary. If you look at our numbers, I think we're at 18% or thereabouts. And when we did our CMO call yesterday, we were all running about 10 to 20% of our patients have been vaccinated. But they're not in the ICU and they're not our deaths. So really, serious illness and death are still preventing. And remember, 80% of the people who are 85 who are coming into the hospital have not been vaccinated, and almost 100% of the deaths have not been vaccinated. So the story remains true. The only people who we're seeing who are dying from COVID who have been vaccinated are terribly immunocompromised patients. And we went through our deaths who have been vaccinated here at KU, and I'll tell you, I went through every one of them, and they're the kind of folks who stepping out on a curb could be an act of death. I mean, they're so darn sick that it didn't take much to tip them over. And if you look at our patients who are in the hospital and not vaccinated with the Delta variant, they're younger and they are sicker. And so you can see that in some of our data. We have a lot of folks here now who are ventilated. So I think that's a problem. The other thing I will just say is, it's interesting looking at our data. When we did our CMO call yesterday, the hospitalization numbers across the community for COVID-19 are up as high as they have been almost since the January start. I mean, it's higher than anything since the November, December, January time period. It's beginning to butt up into that range. Almost everybody's numbers are going up right now. And I think they're going to continue to trend up. I think ours are not trending up because we're so full we can't take transfers in.
So Dr. Polsak, so now you know what your patients are going through. You've been handling COVID patients, long haulers. I know you said you've lost some patients.
Yes.
Just tell me what that experience has been like for you, and just kind of what your patient load has been like.
It breaks your heart. I've had patients die and the families don't understand, and having that conversation, I actually joined in on a Zoom call from a patient that was in the ICU, and the hospital was trying to take care of the patient and explain to the family that she was in multi-organ failure, that she wasn't going to come back. And so I got to be on that call with them, trying to help them understand that she was fine before, but she's not now, and she had many risk factors. But unfortunately, once you get to that point, there's no chance there. And so I also have some very young patients in their 20s and 30s with no underlying conditions who got COVID early on, who now have long hauler syndrome. And it's been terrible. I have one young patient who had to quit her job. She even had to hire someone to help take care of her kids because she simply could not do it. And, the array of symptoms is multi-system, and so it's really sad when people don't understand that this could happen to any of us. It's not just those who are really immunocompromised.
I have a question about long haulers for everybody to jump in on, because I was thinking about this on my drive-in. So if you've been vaccinated, maybe you don't even test, you don't have any symptoms that would make you test, so you have COVID, you don't even know it. Could long hauler symptoms show up even if you didn't have any severe symptoms and you were vaccinated?
I think that's one of our concerns. We're seeing exactly that, Hawk.
Okay.
Yeah, we don't have the full data about people who are vaccinated, get infected, and they are either asymptomatic or symptomatic who go on to develop long haul syndrome. We don't really fully know that yet. We do anticipate that if you are vaccinated, because you are going to be protected against that whole spectrum of disease of COVID-19, that your risk of getting long haul will be reduced as well. So I think that is a good thing. It may not be 100%, but again, it is such a new issue with, number one, diagnosing long haul, but also being fully vaccinated and getting infected, and either being, like you said, asymptomatic or even symptomatic. So we are still looking for some of that information.
I want to clear something up. We have some viewers that have a question, Dr. Polsak, thinking that maybe your autoimmune disorder was caused by the vaccine. True or false?
I don't think so. It wasn't temporally related. And so they did ask me that when I was diagnosed, if it was within a few weeks of the vaccine, but it was not. It was several months later. So I have not been able to link it.
And this is such a, Graves' disease is not an uncommon disease.
Right.
And it happens in people who have never been vaccinated. So, I think there's this temptation that people want to say, oh, I had a medical problem after I got vaccinated. It's the vaccine. Oh, really?
Mm-hmm.
People have been getting medical problems their entire lives. Long before COVID came about and long before there were vaccines, people developed medical problems. So to attribute it to the vaccine, I think, is a scare tactic.
Yeah.
And it's kind of like saying, well, I'm infertile for the vaccine. No,
Yeah.
you're not. Stop that.
So I'm the classic age range to get Graves. I also have a family history of it. The other thing is I had labs in February for my physical and everything was normal at that time, and that would have been 2 months post-vaccination. So if it truly would have been caused from the vaccine, I would have expected a sooner presentation.
Okay, good to know, because we just had a few people thinking that the same thing was caused for them, but hopefully that clears that answer up.
Yeah.
Anything to add?
Yeah.
I think that's...
It doesn't happen that way.
Just no.
Your comment on jumping on symptoms early, I think, is extremely important. And I think now that people are vaccinated, they tend to blow things off. This is just allergies. This is just a cold. But meanwhile, the virus is spreading. And so I think don't ignore your symptoms. Get tested early. Rule it out. That's great if you don't have it. But going on for 4 or 5 days thinking this is just a cold, that's spreading it to everyone.
But I would imagine, is that contributing?
Wear a mask, wear a mask,
Is that contributing to the higher numbers? Is that part of the contribution to the higher numbers?
Absolutely.
People just saying, I got the vaccine, I did my thing.
And actually, if you look at hospital workers, most of our hospital workers are vaccinated. As soon as they start to get sick, we tell them, you got to get tested, because you don't want to give it to somebody. You don't want to give it to a patient. You don't want to give it to each other.
Right.
So even though, we're masked and all that, so I don't think we do. I know we don't, but because we do trace that kind of things. But you don't want to take that chance. And so I tell our folks, as soon as you have any symptoms at all, go get tested. Your child has a cold or a sore throat, go get tested.
So we should be testing the way we were this time last year.
Yeah, be really aggressive about it.
Yeah.
And actually, our test numbers are up in the community, which is good. It's bad. People are starting to feel it. It's good because they are getting tested. The problem is that a lot of tests are done at home now, and so we don't always know the results of those tests because they may do that rapid screen test at home.
Yeah. My kids and husband were safe, and so I think getting tested early helped me keep from exposing them.
And were your kids younger? Were they able to be vaccinated?
They're 8 and 10. No, so they're unvaccinated.
Got it.
Yeah,
Okay.
waiting for that age to drop.
Yes,
for sure.
so am I.
Yes.
Someday soon.
Yeah.
When is that going to happen, Hawk?
We hope soon. We know everything else for data analysis and collection has been expedited with the rest of the vaccination here for adults, and then of course those who are 12 and older. So we're hopeful that it will be soon. We know that they were asking for more children to be vaccinated so that they can maybe identify some of those very rare events sooner than they have with, say, after it's been rolled out or emergency use authorized. So we're hoping soon, hopefully right near the start of school or right before the start of school, so we can get those young kids vaccinated.
Dr. Polsak and I will have our kids front and center, first in line, ready to do it. So let's get to some community questions. Bob Hallinan joining us. Good morning to you.
Good morning, everybody. We have quite a few people who are wondering about those 7 vaccinated patients that we have. They want to know how many are in the ICU and on ventilators, and are they all here because they have severe underlying conditions? Do we know that yet?
I don't know that for certain. What I can say is that in the ICU, we do have 2 vaccinated patients. It's unclear if those patients are intubated or what their comorbidities are. We also do have a couple of the other vaccinated patients who are on the other non-COVID floors. So sometimes that is due to care restraints that we need certain special care teams to deal with these patients, for instance, if they have a certain amount of cancers or other immunosuppression. But that's kind of all I can say. That's all the information I have right here.
We can get more of that information.
Yeah.
We'll get Amanda to help us look at those numbers. Last week when we looked at this question, there were 2 patients who were post-vaccination who were on a ventilator. One of them had lymphoma, had a bone marrow transplant, and now was getting CAR T therapy, which is a really advanced form. We'll be talking about that tomorrow with Joel McGurk. And the other one was diabetic, obesity, high blood pressure, kidney failure on dialysis and had an underlying autoimmune process, and I don't remember what it was. So those are the classic people who aren't going to respond to vaccination, and they're the ones, and that's really what we're seeing. If you've been, quote, vaccinated, and now you're really critically ill, you're in that disease category who I think we would say probably didn't respond to the vaccination, and we've seen some of that data in patients who have end-stage renal disease. We've seen it in people who are immunosuppressed, and especially transplant, et cetera. So I think one of the things we'll be watching very carefully is, are we going to give another vaccination to people like that? Germany just said they're going to do a third vaccine in the same patients, has Israel, has a number of other countries, especially in the EU. I think we're probably going to get there. We're not there yet, but I'm going to bet the FDA is going to come out in favor of a third vaccination for both Pfizer and Moderna. I'm not sure how they'll handle the J&J one at some point. I would also guess that at least cross my fingers that the FDA is going to come out with full approval of the Pfizer-Moderna vaccine sometime pretty soon. It's been speculated they may do it in a couple of weeks, and I don't know if it's that fast or not, but hopefully very soon.
So I would like to say that the patients that we do have, the age range is 26 to 97, and one of the youngest that we have in one of our ICUs is 39. Kind of different than that, though. Those were the adults. I would like to say we do have 13 and 14-year-old patients in here as well. So I think that's important. And as far as the additional dosing, we are still waiting for that.
We are.
But the question, and I've answered this question for physicians, for other people a lot these last 2 weeks, is are we giving extra mRNA vaccine or additional dosing of mRNA vaccine, or are we giving something on a different platform, say like the J&J vaccine? Because there are studies coming out now with mixed dosing that show maybe more robust antibody and more robust T-cell responses with that mixed dosing. And so when I get these questions from physicians, from other people I know, it's really hard to make a recommendation. Number one, because there is no official guidance other than you don't need to give additional dosing. But if you do, are you going to get, if you had the mRNA vaccines, are you going to get Johnson & Johnson or vice versa? So this is a question. Most of this data is coming out of England, so they are looking at Pfizer plus AstraZeneca, which of course we don't have here. So again, still more questions, great questions. We just don't have those full answers yet.
And in fact, we can go so far as to say that under the early use authorization, you're supposed to follow that pretty strictly.
Correct.
And as a result, we really can't write for additional doses.
Correct.
And so that's been kind of our thing, is even if we think it may be the right thing to do, we can't advise that yet, because under the EUA, we're only allowed to say you need to have 2 doses of Pfizer, Moderna, or 1 dose of the J&J.
Will that third dose be phased out the way 1 and 2 was, or do you think anybody could just go grab it?
I don't think we know yet.
Okay.
I think we'll see what that information happens.
Bob?
All right. Isaac is asking, are breakthrough infections more common in those who were vaccinated earlier as opposed to more recently? Any correlation in that regard?
I don't have that information. I know, Hawkeye, I know that when you look at the information that Pfizer now has out there, especially in people who I thought was over the age of 65, they see about a 2 or 3% decrement in effectiveness by month. Yeah. Did you see that last week? They put that out last week.
Yeah, and it is hard to tell, just like you said. Again, we're still calling it breakthrough. I don't know that is the proper term for breakthrough infection. We know infections are going to occur. These vaccines were really made to protect you against that severe spectrum of disease, including hospitalization and going to the ICU. So I think there isn't so much data on that, probably just what you said, but also we know that antibody levels wane, but that is not surprising. That is how your immune system works. Your antibodies generally wane after the initial infection, but the saving grace there is those memory B cells, which when you do encounter the infection, are then quickly ramped up to create those antibody levels as well.
Dr. Seitz, I have a lung question. Please clear this up for Donnie. She said she has an extended family member, had COVID last fall, vaccinated this spring, was having some breathing issues, went for a physical. His cardiologist told him that he had COVID lungs from the vaccine.
Well, no, you don't get COVID lungs to the vaccine, to be clear. That just doesn't happen. What you get are COVID lungs as a result of the infection, because what happens is you damage the airway caused by the inflammation from what the virus is doing. The virus breaks into your airway, and it actually causes your body to respond. And when the body responds in lung disease, it can respond in different ways. But one of the things it does is recruit a type of cell called a fibroblast. And fibroblasts come in, they try to restructure the lung to help prevent further infection, but sometimes they go a little haywire, as it can occur in different kinds of this doesn't only happen in COVID. This happens in bacterial pneumonia. It can happen in a lot of different diseases. It just happens very commonly with COVID, and then you get a lot of scar tissue laid down, and that's a COVID lung. The vaccine only produces the antibody, so it's not capable of causing COVID lung. And in fact, some people have said their COVID lung symptoms got better once they got vaccinated. But to say that COVID-19 caused COVID lung, that's not true. What can happen is that you can have an infection earlier. You may feel better for a while, but unfortunately, the fibroblastic part of this, the scarring part of this, in some patients will continue to progress over time. It got turned on, and nothing can turn it off. And that's the same thing as what's called idiopathic pulmonary fibrosis, or similar. It's in that family of disease. It's not the same thing, but it's in the spectrum of disease. So I think it's not correct to say that the vaccine causes COVID lung. I'm disappointed to hear that one, but it is true that COVID-19 can cause a scarred lung, which is a part of the long haul syndrome, and I bet that's some of the complaints your patients have.
Yes, definitely.
And it's concerning, though, just hearing what Dr. Polsak said, and then this question just goes to show people think correlating these other illnesses
that's just wrong.
to the vaccine.
Yeah, people look for a reason to blame the vaccines for everything, and therefore they don't have to take them. But in fact, that's just not true.
Not true.
Yeah. I like how you mentioned that. Yeah, things have been going on way before COVID.
How are you the vaccine guy?
And I think once some of these questions are answered or there's other proof, there's going to be other reasons that some of the vaccine hesitant people are going to continue to be hesitant, like once it's approved. So a reason that a lot of people don't want to take it is because it's not approved. I don't want to be an experiment. I don't want to be a guinea pig. Well, once it's approved, I'm sure there will be another reason there. So, it's going to be an ongoing battle.
In fact, there's a really nice article. If you have questions about this, there's a very nice article in the Kansas City Star. I think it came out yesterday about the 5 myths around COVID-19, and they did a nice job of detailing of that information. It hit infertility and all. There's microchips in it and all that stuff. And remember, don't be part of the made-up news network. Don't be a part of the MUNs. Stick to the truth and not to rumor reporting. So.
Good advice, Bob.
All right, Gretchen's wondering if a vaccinated person has a bad case of the breakthrough virus, can they be given monoclonal antibodies?
That's a good question.
Yeah, I was talking with our therapeutics group and Dr. Bari yesterday. You can get it if you meet certain criteria. Again, if you're still high risk of going to the hospital in severe disease, you are able to get monoclonal antibody.
All right, Pamela's wondering, is there any information on the studies of people with certain blood types and how COVID affects them?
No. Oh gosh, there was for a while all those people with A-negative blood types. That's me.
Yeah.
I do terribly with this, and then there's you do great with this, and I think at the end of the day, I just don't think we really know enough. It's been out there a lot, but every time there's a new position about it, it somehow comes. Well, maybe that's not true. Mm-hmm. We've heard that the O-positive blood types do the best, the A's do and ABs do worse, but I'm not sure the data around that is kind of. Yeah, soft.
Barry wants to know, do we know when infected people are most able to transmit the virus?
Well,
I think we still believe it's 1 to 2 days prior to symptoms to 1 to 2 days after. And then your viral titers or your viral replication is going to decrease, so you're less likely to do it, any time after that first few days of symptom onset. That was certainly the case with those original variants or the original Wuhan isolate. Again, I think we don't have enough knowledge about Delta variant at this point. That I think there was some information maybe about Alpha or one of the other variants that showed that you may replicate it longer, but that was a small study, and again, I don't think that has gained a lot of traction either. So molecularly or on the virus standpoint itself, we don't really have a lot of information, but generally it's going to be 1 to 2 days prior to symptoms to 1 to 2 days after symptoms start, and then it goes down from there.
And can you clarify for Stacy, are the 13 and 14-year-olds in the hospital, they're here for COVID, and do we know if they're vaccinated or not?
I believe they are not vaccinated, but I don't have that information next to their identifier here. But are they in for COVID? It's unclear. I don't know that.
Can we tackle this question about your transmissibility for just a second, too? Because I think there's some stuff out there with the Delta variant, and confirm or help me with this. Whereas it took 3 to 5 days sometimes to develop the symptoms from the original strain, it may be 1 to 2 days with this strain. So as soon as you start getting some sniffles, it just needs you. Just go get tested.
Yeah.
Because the onset period, the incubation, I think is shorter with the Delta variant.
Yeah, and this was from that Chinese and UK study. I didn't necessarily agree with that part because we have seen even throughout the pandemic, people were getting symptomatic 1 or 2 days after exposure, and there was a large early study published probably April of last year, just after a lot of the pandemic started hitting the United States, that looked at quite a few people, and they had a pretty quick onset of symptoms, but the majority of those people were at that 5 to 7 day mark. So I think that is still something we don't fully understand, but that was postulated in that study, yeah.
All right. Allie is wondering, does Delta infect more easily even if you are masked, vaccinated, and distanced?
Oh, that's a great question. But I think it's that's a hard question to parse out. Here's what we know. Masking still works and it still helps prevent transmission of disease. Can you get it more easily? Probably if you're not wearing your mask. And there's some people that have been postulated the surgical masks are better than the cloth mask, and maybe the cloth mask isn't as effective. I don't think we know that yet. I think the distancing is still the distancing. That has to do with how far your breath cloud goes. And so in any regard, however you look at it, that it looks like the Delta variant is easier to transmit. And so it just makes the key parts of infection control that much more important. Wear your mask correctly, distance correctly. And I think that's probably how I would look at it, Hawk. You just got to follow the rules.
Yeah, I mean, if you're distance, obviously you're going to have less chance of the droplets getting around you.
Hey, we saw the freezer video about our breath cloud, right?
Yeah, there you
6
go.
feet was pretty good.
Yep, and if people are wearing masks as a barrier, and you're wearing a mask as a barrier to help give you a little bit of protection, I think it's about the same as the other variants or the pre-Delta.
And can I just say one other thing? You know what I really want to do when people wear masks? I want to put it up over their nose. Remember we said yesterday, it doesn't work if it's not over your nose. So if it's down here under your nose and you're still breathing, remember the freezer video, we even showed it. Hawkeye had a great breath where I watched it come out of his nose and all the breath clouds right there. And you're like, no, you see, that's not the idea. You got to put the mask over your nose, not just over your mouth. And you watch the coaches sometimes on the NFL sidelines or in the dugouts, and they got their mask below the nose. I'm like, okay, really, what are you doing here? Well, this is not helping.
They're kind of doing it
right.
They're
kind of, well, yeah, maybe.
Yeah, I was at the grocery store last night, Dr. Stites, and I mean, masks are back.
They are back. Thank gosh, let's do it more.
Absolutely. All right. Hey, Dr. Hawkinson, you and I were talking about this the other day. Isaac wants to know, is the Delta known to be transmitted through water? He likes to go to the water parks and with the pools.
Yeah.
Doesn't it die quickly?
Yeah, I mean, I think you're pretty safe when you go out to those outdoor areas, whether it's a beach, the water park, the pool, playing sports outdoors. Now, if you are densely congregated with a bunch of other people, your probably risk of getting it is going to be greater. But doing those outdoor activities, and especially if you're swimming in a pool or something like that, I wouldn't say there's any risk of getting coronavirus.
And Lori wants to know, are there any other variants beside Delta that we're looking at that we should be worried about? Anything up and coming?
Hawk, this is your...
Yeah, again, I think part of the consequence of this is that we have so much access to technology. So we are able to do much more sequencing than they were, say, 20 or 30 years ago. This, coronavirus, SARS-CoV-2 has just opened up a new world of looking at things on the molecular and viral level. there probably will be more variants that we identify. Right now, Delta is the predominant, maybe more fit variant, and so it's really taking over in any place that it goes. If you remember, right before Delta, there was Alpha, and there were some other variants of concern as well. So I think we are going to continue to find virus isolates, which maybe are able to outcompete or become more fit, and so therefore may push out other types of isolates or variants as we go further. Now again, the nice thing to know is that the vaccines that we currently have continue to protect against that whole spectrum of disease, including hospitalizations and severe disease. They do what they are designed to do. So I think that is the one saving grace that we have. But I think moving forward, yes, we are going to be able to continue to identify more variants. You know, what happens when we get to the end of the alphabet? That's going to be hard to say. This is just
beta, beta.
Right. This is just because, you know, the virus will continue to replicate. It will continue to mutate or change in during that replication process to cause to cause these variants. So I think, yeah, moving forward, we will probably find more.
Hey, don't you have a really cool flower vase there?
Yeah.
Yeah.
What is that?
Let's see that, brother.
Well, I don't. So this is the spike protein. I don't have a base for it.
Who made that for you?
You know what this makes me think of?
Neurosurgery group.
You know what this makes me think of? Just right off the top of my head. Instead of having flowers, you don't bring me flowers anymore.
Spike.
You bring the Delta variant. Come on.
So this is the 3D printer of the spike protein.
And I think that the key is that the reason that gets in you is because you're not masked or you're not vaccinated, and then it can reproduce wildly. And when it reproduces, it mutates, and when it mutates, you can get out to other people. The one good news that I'm seeing, at least very preliminary, as Hawk likes to point out, this is preliminary data, very early, but it looks like we're not seeing mutations. I think I saw one thing about this, and it's probably more hopeful optimism, which of course I always like to turn into hardcore science.
Yeah.
That the Delta variant may not mutate in the airway of those who are vaccinated like it does the unvaccinated, because it has a longer lifespan than the unvaccinated.
Yeah,
So.
yeah, certainly. We know that, and we've seen this in case reports. When you're immune compromised or immunosuppressed and you have continued viral replication, it just adds to that process, this error-prone process of replication. You have the chance at that point to have new variants arise in-host, what we call in-host evolution.
Dr. Seitz, do you have time for a few more questions, or check your watch?
A couple more. Let's do it. Let's do it.
Look and see. All right, Bob, you got a couple. I got one too.
Okay.
Go ahead.
Okay. Kitty is wondering, is it too soon to start thinking about rescheduling dental and medical visits because of the Delta variant?
Don't do that. We saw that happen, and what happened is people got sicker, and they came later with their cancers, they came later with their problem, their heart disease and their strokes, and that was a really bad thing. So don't do that, because we keep you safe. Micholee, would you tell your patients to come later? Don't come right now. Is that a good idea? Yeah.
Wear your mask. Wear them properly. Have them wear their mask, and get the health care you need.
Yeah.
Now.
And if you're really scared, then do a telehealth visit, because I bet you're still doing some telemedicine, right?
Yes, telehealth is fantastic. Yes.
It's great stuff. And I mean, I like seeing people in person, but I mean, if we can't, but we know that masking keeps us safe because we keep our staff safe every day up on the COVID floors.
Yeah, and we know for the most part, the dental industry has taken very, very high precautions for this because their employees, their workforce is at risk. And so I think go ahead and get that. We do have some information about one of our pediatrics that is in the ICU, and that is for COVID. So they are here for a COVID reason.
All right. Thanks for that. Okay, so can you clear this up for Isaac? He says he's still trying to understand this. If vaccinated people can carry the same viral loads as those who are not, how does that square with tending to have less severe disease?
Because the vaccine prevents from less severe disease by it allows you to eliminate and get rid of the virus much more rapidly than if you're not vaccinated. And so your body has already got its host defense ready to go because you have been vaccinated in response to the appearance of that virus. So the virus comes, it starts to reproduce. Again, it ramps up more rapidly than the original strain, but then you don't get as sick and it's gone. And I think you've even talked about how you think that probably helped protect you.
Exactly. Yes. And I had antibody tests actually the week before, and so I was still posing an immune response from the vaccine 6 months prior, but I think that my antibodies just were probably not as effective because of the autoimmune disease.
All right, I think we're done with questions. We're going to save any that come in for follow-up Friday. So we're going to get to our final thoughts today. And Dr. Polsak, so glad that you came in and joined us today.
Thank you for
I'll
having
let
me.
you give us some final thoughts.
Yeah, so I think take home from this is please get vaccinated. We know that you can still get sick, but the goal is to reduce hospitalization and death and to reduce the spread, to reduce the mutations. Protect our children, protect each other, our elderly. We have to do this together, and the only way to do it together is to mask together and everyone, act appropriately. Follow the pillars of infection, like he says. Wear your mask, wear it properly. Don't be afraid to. I've tried to just normalize it with my kids, and they're great. They don't complain about it. I think for school purposes, we're going to have to wear masks to get our kids educated. We saw last year that people still successfully ended their school year because they masked and followed good infection prevention. So
start getting our kids ready.
Yes, and then don't ignore symptoms. Please get tested early. Rule it out.
Thanks so much. Glad you're doing well.
Thank you for having me.
Yeah,
Yes,
you bet.
appreciate
Dr.
it.
Hawkinson?
Nothing to add. Dr. Polsak, we need her here at work, and she's well now. So I think just listen to her message, and I would reiterate that.
Dr. Stites.
Today for you, tomorrow for all of us. There's a song from Rent. It goes a little different than that. I'm not going to try to sing Rent, but it's really about what do you want your tomorrow to look like, right? What do you want your tomorrow to look like? Do you want it to look like masking everywhere and public health crisis and people dying and hospitals full and the news every day about more COVID and more outbreaks and more variants? Is that what you want your tomorrow to look like? Because if it is, then stay home. Go out, have a fun time, don't get vaccinated, don't wear a mask. Because you will guarantee by doing that tomorrow looks like today. But I think there's a better way. And that is take action today so that tomorrow is a better day. You can do it. You have the power. Let's go.
I'm going to talk about who's going to be on your show tomorrow.
That is a place where somebody has helped contribute to a miracle of science.
So can I just tell you, the guy said that they would buy me a coffee if I can get Dr. McGurk's title, if I can actually say it properly, because it's very high end. And thank you for sneaking a little Barbara Streisand today.
That would be Neil Diamond and Barbara Streisand.
Oh, it was the duet to end all duets. I know this. I know that. Okay, so Dr. Stites is going to be here tomorrow. He's going to answer all your COVID questions, of course. And Joseph McGurk, Dr. Joseph McGurk, he's the Division Director, Hematologic Malignancies and Cellular Therapeutics, and Medical Director of Blood and Marrow Transplant. Yes, I did it. All right, he's going to talk about the incredible work being done for lymphoma patients. That is tomorrow starting at 8 a.m. So we will see you then. Have a great Tuesday.